The Cooperstown Cam is brought to you by Utica National Insurance Group.
The Centers for Disease Control and Prevention say everyone ages 6 months and older should get the updated COVID vaccines this fall.
And New York's governor says they're on the way. They shipped last night. Governor Hochul says because most people are taking at-home COVID tests and not reporting results, it's hard to get an accurate number of cases. But hospitalization stats don't lie. The governor says they have been ticking up, I should say, since mid-July. In New York State, 80% of those in the hospital are people 65 and older. As for COVID-related deaths, 88% are people 65 and older.
But shame on us if we don't see the warnings, take precautions, be ready, and know that this can spread very quickly. There's no need to be careless. We have the tools we need, treatment, tests, masks, but the best, most effective way to deal with this is getting the vaccine.
The new vaccine is not a booster shot. It's a new vaccine designed to attack the new variants of COVID, and you only need to get one. Reporter Erica Edwards has the latest on the rollout.
Now that the latest round of COVID vaccines have been approved by the FDA and cleared by the CDC, doctors' offices, hospitals, and major pharmacies nationwide like CVS and Walgreens have already begun to schedule appointments to get those shots. Now, the CDC has recommended that everyone ages 6 months and older get the shot this fall, preferably before the end of October. This comes at a time when we've been seeing an uptick in COVID cases and hospitalizations, still though nowhere near the levels that we've seen in previous seasons. Now, this is the first year that we will have vaccines for the 3 most common respiratory viruses that circulate in the fall and winter: COVID, flu, and RSV.
We also are in a different place with respect to all 3 of those viruses. This will be the very first respiratory virus season that we will have vaccines against all 3 of those diseases. Maybe not for every single age group, but for many Americans, this will be the first season where we'll have a vaccine for COVID, RSV, and flu. That's important because up until now, the notion had been that COVID controlled our lives. This is the year that the tables can turn.
The question now is, will Americans actually roll up their sleeves to get these new COVID shots? Last year, when the booster was released in 2022, just 17% of eligible adults actually did. Erica Edwards, NBC News.